Hi everyone, welcome to another episode of Yap Sessions with Ann. If you're new here, my name is Ann, and this podcast is exactly what it sounds like: real conversations, real experiences, just a lot of yapping about life in my 20s. In today's episode, I'll be joined by Ann, and we're going to talk about whether or not you are taking your sexual health seriously. So this is Anne. She's gonna introduce herself and tell us more so you guys can get to know her, her journey, and how she became an OBGYN. So tell us about yourself and who you are, your interests, anything you want to share.
Okay. Hi, my name is Anne Lorraine Rock, and I am a board certified obstetrician gynecologist. Uh, First, I am mother of two toddlers, young ones. So right now, my interests are mostly sleep. Um, but I am a huge foodie, so I like to eat and I like outdoor activities. Um, yeah.
Nice. Okay. So what made you choose to become an OBGYN? Were you always interested in being a doctor, or was that like, is there a specific story that led you to become interested?
As far as being a doctor, since I was young, maybe 4 or 5 years old, I always said that I was going to
Mm-hmm.
become a doctor. So that was something that's always been with me. As far as specifically OBGYN, no. That I did not make that decision until medical school when I had my rotation. I always thought I would either do emergency medicine or go into surgery, which OBGYN honestly is a mixture of both. So.
Mm-hmm. Nice. So, was there something specific in your rotational program that made you interested in becoming an OBGYN?
Yes. So when I was in medical school, during the last couple years of med school, you rotate through different core rotations. So one thing that I do remember is when I was rotating in OBGYN, which I mentioned earlier, I'm a big foodie, so I don't play about my food. And I went like 12-hour shift and completely forgot to eat, and I was just having fun the entire time. I was just so interested. I was just following my attending, and that's when I realized that okay, I really enjoy this.
Mm-hmm.
But really, with OBGYN, I am passionate about women's health.
Yeah.
So that's one. And also, as a field, it does offer a lot of different things. It's a huge scope of things. You do surgeries, you do procedures, you get to really build a long term relationship with your patients. So,
Nice. That
yeah.
sounds so fun. Um, so, getting into this episode, one of the reasons why I really wanted to, have you and talk about sexual health is because I see a lot in my generation that people don't really know much about their body, specifically women or even men, honestly. So what is something or what are things that you see that are very common with people in their 20s that they're confused about or that they don't know about?
Right.
If you have a lot of patients in their 20s or not, I don't know.
I do. I have a huge mixture all across
Mhm.
age ranges, but definitely I would say most of my patients are younger patients.
Mhm.
So, to answer your question, a huge misconception that I see all the time would be about STIs
Mhm.
and who has them, when we have them, and when to worry about having them. And another big one would be around pregnancy.
Pregnancy.
So, just to elaborate with STIs, some people may feel like, oh, if this person looks clean, or if I feel
Mhm.
clean and I am clean, there's no way that I can have an infection. And that's just not the truth.
Mhm.
And just a lot of just crazy things sometimes that I hear about
Yeah.
pregnancy and how you can get pregnant and how
Yeah.
you like prevent pregnancy. So, and that's a huge thing in its own is about like birth control and things like that. But I will say, as a whole topic, is
Mhm.
like a lot of people have a lot of different misconceptions
About
about
that.
pregnancy.
Yeah, I hear that a lot. Specifically like STIs, like on the part of STIs, like sometimes people think just because you look good, you look clean. Even like in my case, sometimes I see people and then I hear that, they have certain things you're like, you would never think that, but it's because, I don't know why we think, oh, just because somebody looks clean, they look pretty, they look handsome, they're clean. Sometimes they're not. And it happens. But when it comes to pregnancy, what do you see or what misconceptions that you hear about?
Yes. So let's focus on maybe things that I've heard about how
Mm-hmm.
you can get pregnant, or actually, let's talk about how you can prevent pregnancy.
Mm-hmm.
Pull out method, not effective. It's just not. Okay. So let's
Yeah.
leave that there. And also, just different things like taking a shower after having sex
Mm-hmm.
can get rid of the sperm and
Mm-hmm.
can stop you from getting pregnant. Certain positions
Yeah.
you can't get pregnant in, or not laying down afterwards, making sure you're getting up,
Yeah.
things like that. Yeah.
Okay. So when something or people feel like they have something wrong with their body, specifically women, when do you think it's time to stop Googling and actually going to the doctor? I think with everything, when we are sick, we try to go on Google and see, like, oh my God, my head hurts or something hurts. Let me go on Google and see. And then we start panicking. So when do you think is a good time to actually stop Googling stuff? And in terms of, women's health, like, I guess, the health of your vagina and things as such.
I think if you have any symptom that is abnormal for you,
Mm-hmm.
you should go see a doctor.
Okay.
Okay. So, first, that does require us to be in tune with our bodies and know what is normal for us.
Mm-hmm.
So, paying attention to that. But any symptom that anyone is experiencing that is abnormal, I think you should,
Should go
yeah,
go
exactly.
to
Especially if you don't know what it is, because Google can send you into,
a
yeah,
spiral.
exactly.
How often do you think that people should go to see a OBGYN?
You should go on an annual basis.
I know.
Everyone, especially women who are sexually active, they should go at least annually.
Mm-hmm. I hear that sometimes, specific going to pap smear, because I know people get pap smears every year, sometimes every 3 years. What is that about? Because why are some doctors saying every 3 years, or some are saying every year? Or is it actually every year?
So the screening recommendations have changed over time.
Mm-hmm.
So it used to be that we were recommending pap smears on an annual basis, but that actually has led to overdiagnosis of a lot of different things that ended up not being as serious as we thought,
Mm-hmm.
and it was not the most efficient. So the
Yeah.
newer guidelines have shown, depending on the type of pap smear that's being done, whether you're looking at the cells and HPV status, between 3 to 5 years
Okay.
is appropriate. Yes.
Okay. So what were they finding that were, misleading in a way?
So, not necessarily the findings themselves, but we were kind of over treating and overreacting,
Mm-hmm.
because the body can clear certain things
Yeah.
easily, or most cases within 1 to 2 years.
Mm-hmm.
So we were just kind of overreacting to it.
To that.
So
Okay.
now that kind of leads the body to give a chance to kind of heal what it's supposed to, and then for things that are persistent, then we're catching it at that 3 year
Okay.
mark.
Nice. Why do you think that sometimes young women just avoid going to the doctor?
So several factors, several factors. One, just in general, I mean, going to gynecologist is not the most comfortable exam.
Yeah.
It's invasive, it is.
Yeah.
So there's that discomfort there. Access to healthcare
That's.
is another huge thing, and also education wise.
Mm-hmm.
Some women, their moms don't teach them, like, hey, you have to start getting this done regularly, or you need pap smear starting at 21 years old.
Mm-hmm.
So I would say a combination of those.
Of both. Okay, interesting. Can you tell us a little bit more about HPV and what it is, and detailed terms and simple terms?
Okay, okay, yes. So, HPV is human papillomavirus, and it is a virus that is sexually transmitted, and it comes in many different strands.
Mm,
The ones that we care about are the ones that cause warts,
mm-hmm.
okay, and the ones that cause cervical cancer,
Mm-hmm.
okay. So, um, There are, with HPV, there are high risk strands. Those are the ones that we that predispose to causing cervical cancer, and then the ones that actually cause genital warts, although can cause bothersome symptoms,
Mm-hmm.
both for cosmetic purposes and actual causing discomfort. Those ones are actually usually benign, so they're
Mm-hmm.
not cancerous, but of course can be a little bit
Annoying for
distressing.
women.
Yeah.
So I know you said that it is sexually transmitted. So how did it came about? And I guess, do men have symptoms, or how does that work?
How did it come about is a harder question for me to
Yeah.
answer, but with men normally not. We
Mhm.
Because there is no official screening test for HPV in men, so
Mhm.
they can't get blood work. There's no urine testing or even swabs. Well, I guess in some cases there would be like anal pap smears that can be
Mhm.
done, but in general, there's no screening test that it can be detected in men. So
Yeah.
really, only women through pap smears can we pick that up.
Okay.
Yeah.
Interesting. So are there any other, I know you said that certain strands of HPV can lead to cervical cancer, and are there any other long-term impact, or that's really the main thing that doctors think about?
Those are the main ones. The cancer causing strains, and not just cervical cancer, I mean throat cancer as well.
Mhm.
So there's different, but in general, yes.
This is the
Cancers are usually the most high risk things that can be caused, and then the genital warts as well. But again, with the genital warts, those are usually benign.
got it. Okay, thank you. What are things that men do not realize that they can pass or contribute to outside of HPV? Things that are not usual. I think when women or men go to the doctors, we get this regular screenings, maybe like chlamydia, gonorrhea, HIV, the list goes on. But are there like specific, I guess, things that men can contribute to, or pass on to women that are not really talked about?
Hmm.
For
Honest.
sorry, I was gonna say, for one, like I know like mycoplasma is like a thing like that I hear about. I don't
Mhm.
know if that's, you tell me.
Yeah, so those are less common.
Mhm.
Less common to act like STDs or
Mhm.
STIs. But yeah, mycoplasma, ureaplasma are bacteria that colonate the genitals for
Mhm.
both male and females.
Mhm.
Sometimes it can act as an infection when
Mhm.
it's at higher levels, but it is actually a common bacteria
Coming back
that a
to your,
lot of people carry.
getting
That
on.
it's not necessarily an infection,
Mhm.
but no, I think you pretty much hit on all the things that men could possibly carry and not know.
Then not know.
Yeah, just the common STIs like gonorrhea, chlamydia, even trichomonas,
Okay.
syphilis. Even sometimes
Yeah.
people, yeah, it's usually painless. The primary symptoms are it's yeah,
Mhm.
so they can pass it on without.
Interesting. So one of my questions is, sometimes I feel like people who are in relationships are not as cautious as people who are maybe not in relationships. And what I mean by that is, sometimes I feel like for people who are quote unquote responsible, when they're single and they have multiple sexual partners, they get tested regularly, versus when people are in relationships long term, they get some type of comfort because they're with one person and they're like, okay, we got tested earlier in the relationship. Why do I need to keep getting tested? Do you think that it's important to get tested every year, or a certain amount of time when you are in a long term relationship?
Yeah, so I think anyone under 25 should get tested on an annual basis, no matter what,
Mm-hmm.
whether you're in a monogamous relationship or you have multiple partners,
Mm-hmm.
multiple new partners. I think that that's the right thing to do, is to get tested annually. However, there are certain things that do put you at higher risk for STIs, which, the things that you've already mentioned.
Mm-hmm.
But age alone does put you in that higher risk category as well.
Mm-hmm.
So, as far as being in a monogamous long term relationship goes, one thing that is important, which you slightly touched on. Okay, they got tested in the beginning.
Mhm.
Always do that. Whenever you have a new partner, always both of you guys get tested together, go to the doctor together, or at least exchange that information when
Yeah.
it's a new partner.
Yeah.
But if you truly are in a trusting long-term monogamous relationship, I will leave that up to the person,
To
to,
know
yeah,
when, yeah.
yeah. But the responsible thing to do is at least annually,
Just
yeah,
get
just take
tests.
it. Yeah.
Okay. How do you think that um what's it called? How do you think men and women can support each other when they're in a relationship? And let's say like if somebody has something or for some reason somebody that's like extreme case, somebody cheats, somebody got something, like what do you think is a way that people can support each other? Like let's say two people love each other, they want to be together, and then somebody has something. Is there a way that people can support each other, or what do you think?
Absolutely. I think first, a huge part of it is about being educated about, what's out there, um, and just different circumstances. But definitely keeping the communication open, being honest with one another, and just, yeah, full disclosure, and just being
Mhm.
open and educate yourselves, because there are sometimes that people do have STIs that are not curable, and they're
Mhm.
going into a relationship, and one person may carry something that the other person does
Doesn't
not.
have.
So they just have to be open and honest, and there are ways and there are things that we have in place to help prevent that transmission.
Mhm.
And sometimes it might be taking prophylactic medication. um, so yeah, just being completely open and honest with your partner, and educating yourselves.
Yeah. So with that, what would you say to somebody who is embarrassed that they have something, how to go about it, and how to move with life?
Yeah, so sometimes we get embarrassed about things because we view things as if we are the only ones.
Mhm.
Like, this is only happening to me, this is happening to me. Kind of live in this, like, kind of world where we think like we're the only ones. But really,
You're
a
not.
lot of these things are very, very common, a lot more common than people know and understand, of course, because
Mhm.
they're not dealing with this stuff
Yeah.
on a day-to-day basis. So I really just try to reassure people that you are not the only one that has been through this, or the only person that's dealing with this. And most of these things, there are ways that we can either give you medication to treat you, cure you, or um, give you or there's ways to treat whatever symptom that
Yeah.
you're having. So
Yeah. Okay. And with that also, do you think that social media plays a part? Do you think that social media hurts the way that people view sexual health, or sometimes it doesn't help at all? Like it hurts or it helps?
I think in general, social media does help.
Mhm.
Okay, it helps as far as exposure, and just putting certain things out there and making people aware that, like, these things exist. This is my body. This is how my body should be functioning. There is a lot of misinformation though,
Mhm.
and there are a lot of people that are, I've seen many different videos that someone is truly just very confident in what they're saying,
And
and
then
they
it's
are
just true.
saying absolute trash, or things that just are not
Not true.
are not true.
Yeah.
And so I would say definitely to just be careful. And if you are going to take something for truth and are planning on acting on it in any kind of way, then to do your own research,
Yeah.
fact check it, and see, if you're going to your doctor, ask questions. Um, but definitely don't take everything you see as truth when it comes to social media. But in general, I definitely do have to agree that social media does put a lot of exposure on certain things,
Mhm.
to where just, yeah, it just
More
more, yeah,
information.
more information, more people are aware of these things. One of the things that you mentioned was mycoplasma.
Yeah.
I've had a lot of patients recently asking me about, testing for mycoplasma and ureaplasma. And I actually had to ask my patient, because I'm like, this is actually something that's more rare that we test for
Right.
when somebody has, like, things that keep coming out negative, and you have recurrent symptoms, and we test for that. But that's something that's usually, like, knowledge that is not common.
Common.
And recently, like I said, I've seen a lot of patients like asking about it, and so I asked someone, I'm like, hey,
How
how
do you
like
know?
yeah, like what just because so many people were asking me, and they're like, oh yeah, I saw it on TikTok. So I was
I
like,
was
that
gonna say that, yeah.
yeah,
There's
so
so many things that I just see on TikTok. Like even for myself, when I go to the doctor now, I just ask because of TikTok.
mhm,
Like different things that I guess are not the typical screening,
mhm.
but you may have. And I think in that way, like social media is definitely helpful.
Yeah.
So
Yeah, I would agree because even if there is some misinformation, just the fact that you know that topic, yeah,
it
I think it makes
helps.
it, yeah.
What is something that you hear people say when they come to you and you're like, please stop thinking that? Like an information, maybe that's
So so
false.
so the first thing that can come to mind, the very first thing we've already touched on,
Mm-hmm.
I can't think of anything
Different.
different right now. But I would say that about STIs. It's like
Mm-hmm.
if I'm clean, how can I have anything?
Yeah.
Or, if I've never had any symptoms of this, how can I actually have an infection? Or if this person is clean, or this person's only been with me, how can
Mm.
this happen?
Yeah.
Yeah.
Even with that, when you're only with one person, like I guess like some I'm like answering my own question, but I guess sometimes it comes with whether people never got tested or maybe somebody stepped out of the relationship. So I guess is that something common that you see like where people come to the doctor, one it and then they have something they're like, what, okay, nobody ever got tested, or two, like that's how they found out that they got cheated on, for instance. Yeah.
Yes, that
That's,
is absolutely very much so common. Sometimes some people are in a monogamous relationship, but it's not mutual. Yeah,
yeah.
it's not mutual, and it happens.
Yeah. So with that, if you could tell women three things that they should be doing after watching this episode or just in general, what would it be?
Okay, so three things. This may sound a little cliche, but three things I would say definitely, especially if you're a young woman. Um, Exercise, regular exercise.
Hmm.
Okay, yeah, regular exercise, and yeah,
Wait,
yeah.
I mean, we can think about, yeah, like, wait, why? Why?
Huh?
Why? I know it's
Just
healthy in general, but like, is there like a specific reason beside like general health?
well, specific to my field. Well, yes, for general health, yes,
Mm-hmm.
it is because there's a lot of different ailments that can from being come from just
Not exercising?
exactly,
Okay.
and it is key to a lot of different disease processes, like for example PCOS.
Mm.
That is something huge, and that exercise is a huge thing with that. Or anyone who's like insulin resistant,
Mm-hmm.
or prone to being insulin resistant, exercise is key. And that's just like, I'm just naming just like
Mm-hmm.
just very few things that but
Yeah.
in general health it is very
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 important.
important. But even for pregnancy related outcomes,
Mm.
exercise is also super important.
Mm-hmm.
Women that have regular exercise regimens are have healthier pregnancies, better outcomes.
Interesting.
Yeah,
Okay.
yeah.
So yeah, that was one thing. You said exercise. What are the other two things that you can recommend?
Is to get tested regularly
Mm-hmm.
for STIs
Mm-hmm.
and for reasons that we've already covered,
Touch. Yeah.
and even more frequently if it is someone who does have multiple partners or multiple new partners.
Mm-hmm.
um and let's see, lastly I would say to have your screening test done.
Mm-hmm.
Have your screening test done because they are there for a reason. So
Mm-hmm.
starting at 21 years old, get your pap smears done. I have seen women with cervical cancer in their 30s.
Oh wow.
Yeah.
Okay. Thank you so much. That was such a helpful, episode. I hope everybody can get something from this. Like she said, go get tested, get your pap smears, and exercise. That's it for today's episode. I hope you learned a lot of information, and just remember to always take care of your body. Sometimes we talk about health and we only focus on one thing, or mental health, or physical health, or in today's case, or sexual health, but everything is related. So make sure that you get your annual screenings and you make sure that everything is okay. Send that to a friend, show some love, comment, and I'll see you in the next Yap session.